Welcome to the Breath Empowerment series here. We're going to give you a 25 minute breathing exercise here that's going to give you the opportunity to have a nitric oxide release throughout your whole body and reach an oxygenation in your tissue that you've probably never experienced in your life. It's a unique experience and one that you need to be prepared for by having a flat spot to lay down. And so you're going to want to find a comfortable spot. You can lay down on a carpet, you can lay down on a yoga mat, you can lay down on the hard floor itself and go through this process. But I recommend some sort of carpet or padding for most of you. But go ahead and take a few seconds to get comfortable, grab whatever supplies you need, and I'm going to give you a little bit of background on the nitric oxide again. The goal here tonight as we do this respiratory thing is we're going to be lowering the CO2, carbon dioxide level, and releasing a massive amount of nitric oxide. We're going to get a huge dilation of every blood vessel in your body, and you're going to reach oxygen levels within those cells that's going to have a big detoxification effect. So the urine and the sweat and the breath over the next couple hours after this can have a big exhale or expelling of toxin and other kind of stagnant nutrients within your body, because you're going to be turning on metabolism, building fuel, and burning out toxin from cells that have been long stagnant in your system. Very powerful at turning over damaged cells. Cancer does not like oxygen, so the more damaged the cell, the more difficult it has dealing with high levels of oxygen. And so this oxygenation that you're going to get out of this breathing exercise over the next 20 minutes is going to be a huge tool for you. And if you do have cancer or severe dysfunction, then I would say you want to build this into a daily practice. The more times you do this in a week, the more you're going to get that big, huge turnover of damaged cells. And so really strongly encourage very frequent use if you're under acute inflammatory or cell damage state. If this is more just for optimal performance and you want to just improve this, I would certainly do this before an event. So doing this an hour or two before a competitive event will give you a competitive edge. So a couple hours before, do this big nitric oxide dump. It will get the whole body regenerating nitric oxide and all kinds of turnover going. And then I would precede this with, like, if you're going to do an exercise burst, just 3 minutes of this breathing, not 20 or 30 minutes, just 3 minutes to prime that nitric oxide dump. And so if you're going to go to the gym and do some resistance anabolic training, just do 3 minutes of intense breathing on the floor of the gym before you go and hit the weight machines. And so this is a very powerful tool. So to get ready now, you're going to lay down on your back. And before you do, though, I want you to take note of a position before you lose sight of your TV monitor there, or your computer monitor. So you're going to be in two positions during this, and I'll describe one just flat on your back, and then the other one is up on your elbows will be how I describe it. And when I say up on the elbows, it's going to look like this, where you're kind of like in a lounge poolside position there, where you got your weight distributed along the forearms and the elbows. Your hands can be tucked under your tailbone for comfort there. And this is the position where we're going to take this on a few times during the exercise routine here during the breathing. The rest of the time will just be flat out, like in Shavasana, flat on your back if you're a yoga expert, and so you'll be in that comfortable, relaxed position, generally feet slightly apart, kind of keeping your hips in a neutral position. Try to take the weight off of your low back by getting a little bit of curve in your low back so that you're comfortable there. And so work on symmetry for a second. Make sure your mouth is closed and you're breathing through your nose. As we go into this really rapid breathing, you're going to note that there's so much breathing that you can dry out your nasal membranes. And so a lot of people will have the best success breathing in through the nose and exhaling through the mouth. Breathe in through the nose and exhale through the mouth. If you want to entirely nose breathe when you start this, that's going to be absolutely fine. But doing the in through the nose, out through the mouth pattern can be helpful. Again, when we say up on the elbows, you'll go into this position here, and then we'll drop back onto our back. And I'll explain that a few times. But now you can go and lay down. You don't need to be able to see your monitor at this point. You just need your audio, because I'm gonna set a tempo of our breathing here, and we're going into this experience. As you're getting comfortable, as you're getting situated there, A couple of reminders of the things that you're going to experience. Muscle cramps are common. Tingling all over your body usually precedes the muscle cramping. So the first symptoms you're likely to feel, which are again good things, you're actually dilating all your blood vessels, getting oxygenation of tissue that's not usually dilated and oxygenating. And so that's going to happen in the first few minutes of the breathing. And then as we move into 5-10 minutes in, it's not unusual for your feet to cramp or sometimes your hands cramp. If that happens, you just relax, lay back, and slow your breathing down. Within 30 seconds or so, the cramps will let up. Sometimes if you've really exceeded your capacity, you'll just need a couple minutes to resolve that. So I just encourage you to relax, ignore the respiratory rate that I'm setting at that point, and let your body adapt and relax those muscle groups, and then slowly bring your breathing back up to the rhythm that we're setting for the exercise throughout. I usually like to have my eyes closed through a lot of this, but some people really prefer eyes open, looking at the ceiling or looking off at the horizon when we go up on our elbows. And so we'll take you through that. All right, so I think we're ready to start here. Before I set the tempo, I want to just take a couple seconds of silence together. All right, so we're going to start with the respiratory. Hands can be at your sides, palms up, legs relaxed. Here's your breathing rate. It's going to be in through the nose and out through the mouth, or in and out the nose as your preference. In through the nose, out through your mouth. Keep going. At this point, it's common to feel dilation in your ears, sinuses, tingling behind the eyes. You keep going, breathing hard in through the nose, out through the mouth. Keep going. Now we're going to shift position. We're going to get you up onto your elbows here. Move up onto your elbows, looking straight forward over the horizon, either with your eyes closed or your eyes open. Peer off into the horizon. And now we're going to take the 50 deepest breaths we've ever taken. In this position, we can stretch the chest a little bit more, and we're going to really expand. And at this point, you can be moving. You can be throwing your head back a bit, and then breathing out to the horizon, breathing up in, expanding the chest, and back out. 50 of the biggest breaths you've ever taken. Here we go. In. 20. That's 40. Now the biggest 10. Big 2. Good. Back down. Lay it flat. Whole body is tingling. Face, chest, ears. You'll notice inside your ears massive tingling, huge oxygenation of the whole system. It may be actually hard to hear because you're starting to get a hum and rush in the ears, tingling of your face, around the mouth. You may be having some early cramping of the feet, and just keep breathing now. Keep the pace going, in and out. Tingling in your hands, common. Feet now. You're going to go back up on your elbows. Looking straight ahead. Eyes open or closed, doesn't matter. Keep the breathing going. You may have seen this coming, but we're going to make a move now. We're going to go to the 50 deepest breaths you've ever taken. We're going to supersede what we did before. You are broken in now. You're ready to move those ribs. We're going to go for the 50 of the biggest ones. Here we go. In. Out. Two big ones. Back down on your back. Keep it going. Keep it going. Relax your body now. Keep breathing. Lots of tingling now. Your hands may be numb. You may have cramping in your hands or feet. Keep your breathing going. You can slow it down a little bit if you need to, but don't stop the breathing. Keep it moving. In and out. Keep going. This is totally different than the belly breathing you may do with yoga or pranayama or even your square breathing. This is huge chest breathing, big expiration, inspiration, huge expansion of the chest, massive movement of air, big movement of the ribs, intercostal muscles, shoulders, neck and back. You're getting huge movement just to get this much air movement going. Keep going. This is getting ready for battle. Big, huge, massive movement. This is now getting all of the energy movement, stagnancy, getting every fiber of your body mobilized for massive inspiration, expiration, massive muscle building, massive energy expansion, master expansion of where you are in your body. So keep this moving now. We're going to move up onto our elbows, and you're going to do the 50 biggest breaths you're going to ever take, and then we're going to relax. So up onto your elbows now, 50 massive breaths. Here we go. Biggest breaths you've ever taken. That's 20. Keep going. Bigger. 10 biggest breaths you've ever taken through the mouth if you need to. Two. Biggest breath. Relax. Fall back onto your back. Congratulations. That's the biggest, most intense oxygenation you've ever done in your body. You can just slow down now to silence. Notice with some sort of amazement that you actually can experience complete deep relaxation here with almost no breathing. Your carbon dioxide levels are so low, oxygenation so high that you don't even need to breathe. Looking to the ceiling through your third eye with your eyes closed, you can look through your forehead, if you will, at the ceiling now, and experience for the next few minutes the horizon or the far distant future through your forehead there. Looking out into space, time, and the energy around you. Relax out into that distant space. Let your focus expand further, past the ceiling, out towards the sky. Push your view all the way out towards the clouds. Push your view now to the very extremities of Earth's atmosphere, through your forehead. And now for the next few minutes of silence, expand out into the universe. Now I want you to become aware of all the space around you out in the universe. And I want you to picture gathering all of the energy from the vast expanse of the universe. From the darkest corners of space, you're going to collect all of that light energy that is the vibration of the universe itself and collect it back into your body. Through your forehead, pour that energy back into your body, filling up your body all the way down your forehead and your face and skull, neck, shoulders, chest, abdomen, hips, floor of the pelvis, thighs, calves, feet, filling with that energy now that you're collecting from the furthest scopes of the universe. Relax now and start to come back, start to retract back, pulling yourself back towards your physical body now. Past the galaxies, approaching Earth again. That blue marble floating in space, enveloped in the love of the universe. Let's accelerate back towards the surface of the Earth, like your Google Earth experience, zooming back towards that map of your globe, back towards your country and the land in which you are laying right now, back towards your neighborhood the roof of your house, zipping back into the room that you're in. Now back into the body, aware of your skin, the boundaries of your physical body. We've collected all that energy from space and time and have it collected here in the body with you now. I'm going to depart from your space now and leave you at rest in this environment for as long as you would like to take advantage of the space you just created in your body through this incredible exercise. Lay there and enjoy the silence. Good night.